an early day post Valentine's video. And what I would like to do is piggyback off of a colleague who made a video yesterday about a patient of his who had already gone through a lumbar spinal fusion surgery from years ago and is suffering with a diagnosed, seen on MRI, disc herniation, and the guy's just in lockdown pain. And his lumbar spine is already fused at that level and the level below, on top of the fact that he's had discectomies, and now here he is in this situation where the disc is blown out, it's touching a nerve root, he's in a ton of pain. And this colleague of mine said, had this person just been given the opportunity to first, or the recommendation to see a chiropractor first, he might not even be in the situation, or at the very least, it possibly could have been addressed properly by the surgeon, in the sense of, and I'm not ragging on surgeons, I had a great one, my surgery, which we'll get to. There just shouldn't have been a reason that the disc in that level is blown out and herniated. Like, all the material should have been, cleaned out, or the surgery should have been done in such a manner that there should not have been remnants of a disc at that level for it to be pushing out through a nerve root. I mean, it just doesn't, it's a really sad situation. And inevitably, this person is likely going to have another surgery to remove the disc material, which, you could even say, and I'm even going to jump out in front of this, like, it could be sequestered fragments from a disc above that still had disc. So let's just get that out of the way. I like to cover all my bases when I'm sort of being a little bit hypercritical of a situation. But, I had back surgery, which was what we call laminotomy for amyotomy, or laminectomy for ammonectomy. There's a different subtle nomenclature, ways to say it properly, to remove partial bone and ligament fragments and parts of my or structure that was compressing my nerve roots and my spinal column. And since then, I have been in a lot less pain. Like, if I was going to come in here and tell you how much pain I was in for the last couple of years on and off, I mean, it's not fun. And I am doing a lot better now. But it took, let's see, my surgery was early September, so it took until, February, whatever, or sorry, it was more like January, when I really started to feel like I had more energy, less fatigue in my back, and was starting to really heal. And, that's many months of healing, right? Hold on one second here. And no, I'm not going to restart the video. And throughout that many months of healing, it's interesting, because I'm a chiropractor who treats majority of people with back pain. And if you're a chiropractor and you don't treat a majority of people with back pain, then either you're lying to yourself, your public, or you've just really kicked ass at getting a niche or a boutique practice that everyone who comes to see you really isn't about back pain, at least preliminarily, right? And that's awesome. I still am the guy that most of my patients that come in, it really is, back pain, neck pain, whatever, but back pain. And with that being a majority of patients, and, me as a very transparent, talkative chiropractor who really loves to interact, get to know my patients, a lot of them know that I had surgery. Not all of them, but a lot of them know, especially the people that have been with me, and they were like seeing me on these days where I couldn't stand up straight. And so a lot of guys, gals, in this particular circumstance, most of the guys with really chronic bad back pain, they're like, should I get surgery? Oh, you think I need surgery? It's like, oh, am I going to get surgery? Like, is it my turn to get surgery? And to piggyback off my colleague's video, no. Like, no. And it's not it's like I get surgery, you don't get surgery. It's you have to understand what type of life-altering pain you should be in to actually pull the trigger and do something as life-altering as getting surgery. Sometimes it is like misinterpreted and miscommunicated and misunderstood by all parties involved how serious surgery is. Let me repeat that for you. Back surgery, lower back surgery. And I'm not going to say nowadays laparoscopic. See, I jump out in front of everything. Laparoscopic or microscopic, those like discectomies where they're going in very, very, very thin marginal lines and lasers and pulling out a disc. We're not talking about that. When you are getting cut on and get what I get, that's pretty invasive surgery, whether you want to admit it or not. That's a lot of tissue getting cut open. That's a lot of bone getting contacted. That's ligaments. Your spinal cord is becoming infringed upon by a surgeon's tools and steady hand, you hope. If you are getting a 360, that's the most common one, a spinal fusion, older generation. Folks, when you have a bad spine, that bottom, your spine at the bottom is all jacked up, they call it a 360, front to back fusion, L4, L5, L5S1, very common surgery. If it is even a little bit crooked, a little bit off, if a screw goes in on a wrong angle, you're going to have what's known as failed back surgery. No, Axel, don't do it. So I want you to understand, getting surgery, getting back surgery is no small feat. It's a big deal. Going under anesthesia is a big deal. Recovering from surgery and everything that's involved in getting surgery is a big deal. So the synopsis of this video is, don't come to me or go to another chiropractor or doctor, whoever. Don't talk to your friend and be like, oh yeah, I'm just going to get a surgery, just cut it and it'll be done. Well, one and done for me. Oh yeah, it's my turn now. I'm going to get surgery for my bad lower back. If you are not in like disabling pain and have exhausted all conservative efforts to keep yourself from getting surgery, then you are not a candidate for surgery, for certainly my opinion, but I believe that is a shared opinion amongst all efficacious, moral, ethical, practicing physicians and or providers. Please know this, because it is too important to understand how great and how wonderful conservative care, and yes, I'm referring to chiropractic care and proper exercise, nutrition, lifestyle, keeping weight off of your joints, keeping inflammation very, minimal as you possibly can in terms of like daily stress, nutrition-induced type of inflammation. Obviously, I always say rule number one is don't get hurt. Be careful out there. Just be mindful of your body. Do things that increase the probability of a very good, stable, and mobile foundation and core, right? Really, at this point, I'd be carrying on. So that is what you have to understand about being a candidate for surgery. That's what you have to understand about actually saying things like, oh, I'm going to get surgery, or my doctor suggested that I get surgery, okay? So you guys hang in there. I wanted to share with you this weekend, and have a wonderful day.